all, welcome back to the part 2 of updated warm-up question series that we often see in OET speaking exams nowadays. Let's begin with the very first question for today's video. The first question is, how do you maintain patient confidentiality? If you're getting such kind of question, you can answer like this. For example, I strictly follow the rules to protect patient information and only discuss the patient details with authorized personnel, that is also in a private place away from others. Moving on to the second question. How do you approach patient care when there is cultural differences? When there is cultural differences, I'll put an extra effort to understand the cultural background of the patient, respect their practices and beliefs. I'll also engage in an open communication with the patient as well as the families to ensure their cultural needs are being met. Now, let's see the third question. How do you explain complex medical procedures to the patient? If you're getting such kind of question, you can answer like this. I use simple and non-medical language for the explanation, and I strictly avoid typical medical jargons. And if the situation demands, I also use visual aids or diagrams for the better clarity of the patient. Now, let's move on to the fourth question. How do you approach the care for an elderly? If your patient is an elderly one, then I'll approach them with much patience, respect and dignity. I'll clearly communicate with them and allow some time for their response. At the same time, I'll also give attention to their physical and emotional needs as well. Now, see the last question for today. How do you handle the changes in the workplace? So you can answer like this. I embrace the changes in the workplace by being flexible and open-minded. I'll take some time for the thorough understanding of the situation like procedures or protocol and try to incorporate them in my workplace or my work practice. And that was the end of today's video, and we'll meet you in the next one. ഉറപ്പാണ് വിജയം.